Some time ago, I conducted a rather informal survey of caregivers for those with dementia. I asked them what their most pressing question was at the time. I probably received more than 50 separate questions. Each question was different based on what their loved one was experiencing at that time. However, there were several that were asked repeatedly. This series is going to focus on some of the more common questions in hope that perhaps you or someone you know has the same one. Today's topic involves the difference between palliative care and hospice, and how to know when it's needed for a person with dementia. Let's start with some basic definitions. According to the National Institutes of Health, palliative care is a specialized medical care for people living with a serious illness such as cancer, heart failure, or dementia. Patients in palliative care may receive medical care for their symptoms or palliative care, along with treatment intended to cure their illness. A palliative care physician has indicated to me that basically two things are needed to be present for palliative care to be covered under insurance, and these are a diagnosis and some sort of suffering. A palliative care team is made up of multiple disciplines of medical professionals that work with the patient and family to provide medical, social, and emotional support. To begin to receive palliative care, you must be referred by your primary care provider to a palliative care specialist. You may even request such a referral from your provider. This care can be offered in virtually any setting, including your own home, hospitals, assisted living, or skilled nursing facilities, to name a few. Medicare, Medicaid, and insurance policies may cover palliative care. In addition, veterans may be able to receive palliative care through the VA. Again, according to the National Institutes of Health, hospice care provides comprehensive comfort care as well as support for the family. However, with hospice, attempts to cure the person's illness are stopped. Hospice is provided for a person with a terminal illness, who the doctor believes he or she has 6 months or less to live if the illness runs its natural course. A hospice team is comprised of physicians, social workers, clergy, nurses, and specially trained volunteers. Hospice is a philosophy of care, so it is not associated with a specific location, but can be offered in two types of settings. It can be offered in your home or in any type of medical facility. There are even separate hospice houses where a person can reside while receiving hospice care. Having a dementia diagnosis can sometimes hasten the ability to receive these services. It's important that you ask your primary care provider if your loved one may qualify. Many people view these words as frightening, and I certainly understand that. But I want you to think about it as a wonderful tool in your toolbox to help you during this time. These services, particularly hospice, can also open another door of reimbursement from Medicare, which can also help cover some of your costs. Especially with dementia, I encourage people to consider this possibility sooner rather than later. Caregiving is one of the hardest things a person can undertake. Utilizing every possible resource may help. If you would like to learn more, or have us put you in touch with the professionals in your area who can help, please contact us today.